sharing my pitch plan for human trafficking. So, human trafficking actually has many different definitions, but basically what it is it's any involvement of force, fraud, or coercion to obtain some type of labor or commercial sex act. So this can be men, women, children, and it's worldwide. And especially right here in the United States, which I think most people aren't aware of how prevalent it is here as well as other areas of the world. Usually the traffickers will use violence, manipulation, tell them that there's good paying jobs or romantic relationships, and that's how they lure them into these false sense of security and trusting them, and then they become involved in these situations that they have no control over. Usually they're looking for people who are susceptible, such as emotional issues, psychological issues, economic hardship, if they don't have family, any kind of safety net, natural disasters, or even political instability, which I think, if we look at how we are as a country now, you can see how easily people can be coerced and manipulated into feeling and thinking certain things when they're in a state of anxiety. So a lot of the trauma that's caused by the traffickers can be so great that most people will never come forward and ask for help or even say anything, even if they're in an active public setting and in a trafficking situation, which is crazy. So this is just some statistics that I really wanted you guys to see. I was actually really surprised when I looked at the trafficking locations about how prevalent it really is on the East Coast. Florida especially is like covered. And then where I am, up towards Pennsylvania, the Philadelphia area. And then you see it more along the very edge of the West Coast, California, Washington. Um, but you really don't see it as much in like the Midwest areas. And I actually thought maybe I would see it closer, maybe to the Texas border, although it is prevalent in Texas, but it's more the eastern side. And for the 2004 through 2016 trafficking by gender and age, this one I actually thought was really interesting too, because usually you think of trafficking as women and young girls. And it does look like that trend is actually, it is changing. Women still make up the majority of this, but even the men, if you look at 2004, went from 13 to 21% in 2016. If you look at, younger girls, it went from 10% to 23%. So there are definitely some changes that we're seeing. It's not so much one gender or one age range. It really is starting to bloom into all ages, all races, all genders. So this is just some statistics that I really So, who do I need on my team? If I'm going to be proposing this, I know it's got to start small. Um, you really can't get to the big guys until you conquer the small guys, right? So, you need to, get in touch with those private sector employees. So these could be people that could encounter their, trafficked individuals at a workplace. It could be a hotel, a restaurant, a bar, even a grocery store. Healthcare professionals, they can encounter people too, doctors, nurses, dentists, practitioners, or even like clinics is a huge one. You have to look for transportation, so that could be taxi drivers, flight attendants, rest stop employees, and education officials, so teachers, school counselors, principals, school nurses. All of those people need to learn the signs, the signals, the education on what this could look like, what traits they could exhibit. And then you have to go more to the government officials. So these are the people that have the access to the establishments, um, where a lot of these places are going to occur. So you think like labor inspectors, huge place, factory inspectors, food industry, consular offices, tax authorities. All of these people in these government positions are in a high probability to see some of this. It's all about recognizing the signs, which is where that education is going to come into play. You also need the global organizations. So you need the UN, you need the Organization for Economic Cooperation and Development, the Association of Southeast Asian Nations, African Union, Organization of American States. It takes a worldwide initiative to really combat this huge and prevalent issue. So for my approach, I would suggest a cross-sector collaboration, first for general education. This is huge. You can't do something unless you're educated on the who, what, where, when, why, right? So it would be for general education. So in a lot of cases, like law enforcement, local government, even non-governmental organizations don't have the expertise or even the sensitivity or experienced personnel to deal with the needs of people who are victims of human trafficking. So the states really need to form a basis of a national and international cooperation. So the international cooperation, I think, is so huge because the data that we get is so inconsistent yet. We are sharing numbers, we're sharing data across the world, and as the literature and the studies, they are growing, those gaps in the data that is really significant and we know that it's accurate is still not there. So once that education part comes out and people are sort of knowing what they're looking for, it really has to become something that's a solidified unit that people can rely on the data that's coming in and know that what they're seeing and acting upon is accurate. My proposed agenda for public health research on human trafficking would be determining the prevalence and incidence, which is what I was saying, about our data. Estimating the cost burden of human trafficking. Obviously, your funding is going to be a huge issue. So an estimate of, what this is going to take, the manpower it's going to take, that's a big issue before you can step into anything else. Also identifying risk and protective factors for the victims, because a lot of times these victims are they have to testify on trial, or they're placed in like shelters instead of environments that are really going to promote them becoming an active member of society again. We need to investigate the effectiveness of healthcare screening, which is huge. And that's not just for trafficking. I mean, that's across the board. And implement and evaluate human trafficking prevention strategies. People don't know how to prevent it if they're not aware of what it is and what it could look like, what it could not look like. Education is huge. So that's the starting point, but you definitely need a cross-sector collaboration. Get that education out, work with your communities, get that ball rolling, because the more that you get the local, then you get the state, then you get the national. So it's important to start somewhere, and starting with education is always the best step. So that is my presentation and my pitch idea, and I hope you enjoyed it.